Cluster headache causes. 1. Hypothalamic dysfunction. The hypothalamus, a small region at the base of the brain, is believed to play a significant role in cluster headaches. This area regulates the body's biological clock, including sleep-wake cycles, and disruptions here might trigger cluster headaches. 2. Genetic factors. Genetics can be a factor, as cluster headaches sometimes run in families. If a close relative has cluster headaches, the risk of developing them is higher, suggesting a hereditary component. 3. Histamine and serotonin imbalance. Cluster headaches have been linked to abnormalities in histamine and serotonin levels. These neurotransmitters play roles in inflammation and pain regulation. An imbalance can lead to the dilation of blood vessels in the brain, causing the intense pain of a cluster headache. 4. Cranial nerve involvement. The trigeminal nerve, which is responsible for facial sensations, might be involved. Irritation or activation of this nerve can cause the severe pain experienced during a cluster headache. 5. Environmental triggers. Certain environmental factors can trigger cluster headaches in susceptible individuals. Common triggers include strong smells, like paint fumes, gasoline, or perfume, bright lights, high altitudes, and sudden temperature changes. 6. Alcohol and smoking. Alcohol is a well-known trigger for cluster headaches, especially during a cluster period. Smoking is also a risk factor, with many cluster headache sufferers being smokers. Quitting smoking may reduce the frequency of attacks. 7. Dietary factors. Certain foods and drinks can act as triggers. These might include processed meats containing nitrites, aged cheeses, foods high in tyramine, like red wine and certain types of beer, and excessive caffeine intake. 8. Stress and emotional factors. While not a direct cause, stress can exacerbate cluster headaches. The release of stress hormones and the physical tension can make the brain more susceptible to an attack. 9. Seasonal patterns. Many sufferers notice that their cluster headaches occur at the same time each year, often during seasonal changes. This has led to theories about changes in daylight, temperature, and barometric pressure affecting the hypothalamus and triggering headaches. 10. Sleep disorders. Irregular sleep patterns or sleep disorders, such as sleep apnea, are often associated with cluster headaches. Ensuring regular, quality sleep can be an important preventive measure. 11. Hormonal changes. Though more common in men, women who suffer from cluster headaches may notice a correlation with hormonal changes, such as those related to the menstrual cycle, pregnancy, or menopause. Cluster headache treatment. 1. Acute treatments. These treatments aim to relieve pain quickly once a cluster headache begins. A. Oxygen therapy. Description: high-flow oxygen delivered through a mask. Effectiveness: provides relief within 15 to 20 minutes for many sufferers. Usage: inhale pure oxygen at a rate of 12 to 15 liters per minute. B. Triptans. Description: medications like sumatriptan and zolmitriptan. Forms: injectable, nasal spray, or oral tablets. Effectiveness: fast-acting, particularly in injectable and nasal spray forms. C. Intranasal lidocaine. Description: a local anesthetic applied through the nose. Effectiveness: provides quick pain relief for some patients. Usage: administered as drops or a nasal spray. 2. Preventive treatments. These treatments aim to reduce the frequency and severity of cluster headaches. A. Verapamil. Description: a calcium channel blocker. Usage: taken daily to prevent cluster periods. Monitoring: regular ECG monitoring is required due to potential heart-related side effects. B. Corticosteroids. Description: anti-inflammatory medications like prednisone. Usage: short-term use to break the cycle of cluster headaches. Effectiveness: often effective in reducing the number of attacks quickly. C. Lithium. Description: a medication commonly used to treat bipolar disorder. Usage: can be effective for chronic cluster headaches. Monitoring: regular blood tests to monitor lithium levels are necessary. D. Topiramate. Description: an anticonvulsant medication. Usage: used as a preventive treatment. Effectiveness: can reduce the frequency of cluster headaches. 3. Alternative and complementary treatments. These treatments can be used alongside conventional medical treatments. A. Melatonin. Description: a hormone that regulates sleep-wake cycles. Usage: taken before bedtime to reduce nighttime attacks. Effectiveness: some patients find it helpful. B. Capsaicin nasal spray. Description: derived from chili peppers, it can desensitize pain receptors. Usage: applied as a nasal spray. Effectiveness: may provide relief for some individuals. C. Lifestyle changes, sleep hygiene, maintaining a regular sleep schedule. Diet: avoiding known dietary triggers like alcohol and certain foods. Stress management, techniques like meditation, yoga, and regular exercise. 4. Surgical options for severe, chronic cluster headaches that do not respond to other treatments. Surgical options may be considered. A. Occipital nerve stimulation. Description: a device implanted near the occipital nerve that delivers electrical impulses. Effectiveness: can reduce the frequency and severity of headaches. B. Deep brain stimulation. Description: a surgical procedure where electrodes are implanted in specific areas of the brain. Usage: used in very severe cases. Effectiveness: can provide significant relief for some patients.